Hello and welcome back to Yashoda Hospitals online segment, the Health Talk session. Thyroid disorders are one of the most common endocrine disorders across the world. In India too, there's a significant burden of thyroid disorders. According to recent research, about 42 million Indian adult population in India are suffering with thyroid disorders. So let's discuss about thyroid disorders in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. Somnath Gupta, internal medicine consultant from Yashoda Hospitals, High-Tech City. Welcome, doctor.
Thank you.
So, doctor, can you brief us about yourself and your journey in this medical field?
Hi, I am Dr. Somnath Gupta. I am a senior consultant physician and diabetologist. I started my journey in 2009. I've been trained DNB internal medicine and diabetology. I did few fellowship programs in infectious diseases as well as joint disorders and rheumatology, and diploma course in endocrinology as well as diabetes. At present, I am working as a senior consultant internal medicine as well as diabetologist in Yashoda Hospital, High-Tech City branch.
So, doctor, is that pretty accurate about the literature which suggests that about 42 million Indian adult population are suffering with thyroid disorders?
Thyroid disease is the very common disease which we encounter not only in India but globally. And thyroid disease per se, we need to know a lot about thyroid. It's been a lot of people suffering with the thyroid and it has been diagnosed, but there are a lot of people still they don't know that they have a thyroid disease and they face suffering with a lot of symptoms which per se they don't know that it's because of thyroid. So basically, before knowing about thyroid diseases, we need to know about what is thyroid actually. So thyroid is a small gland which is in the base of the neck. It's like some butterfly shape, which is we know about windpipe. Just in front of the windpipe, there's a thyroid gland. This thyroid gland has many functions which controls almost all the body functions. Basically, all the body function metabolic rate is controlled by the thyroid gland. In children, it also helps not only in controlling the metabolic rate, but also it helps in growth and development of all the organs of the children. So when the metabolic rate disturbs, it's because of thyroid gland not functioning properly. So thyroid gland may function on excess or may function on an under level. When thyroid is not functioning properly, we call it as hypo, and when it's functioning excess, we call it as hyperthyroidism.
So, doctor, you've just mentioned that most of them do not even know they're suffering with hypothyroidism. So, in general, what are the symptoms that one should look out for?
So, basically, as I said prior, thyroid controls basal metabolic rate of all the organs. So, it mainly controls the digestive system, it controls our heart functioning, heart rate, it controls the breathing patterns, it controls the skin related issues, it controls the hair growth. It also helps in menstrual cycle regulation in females. In males, it controls other hormones. So basically, thyroid is an organ which controls all the body functions. So when thyroid is not functioning properly, mainly in terms of hypothyroidism, we have a low heart rate. The patient have some kind of rhythm disturbances in terms of heart. They have some kind of regulation, temperature regulations in the skin. They feel cold intolerance. They have decreased appetite because of which they gain the weight. They have a hair loss, loss of muscle strength, having body pains, myalgias and joint pains. And they have all the features like because of the decreased metabolic rate in the body, they may be having a symptoms called puffiness of the whole body. We call it as myxedema, which is a critical stage of hypothyroidism. And our psychological, neurological issues can also be hampered and can develop sluggishness of the movements, as well as they become weak in terms of thinking, in terms of physically also. Similarly, when the thyroid functioning is on the higher end, what we call it as hyperthyroidism, quite opposite to the hypothyroidism symptoms occur. Their heart rate is high, they have feeling of palpitations, they have these tremors, hands become shaky, they have this hair loss, they become more active, their sleep pattern gets disturbed, having insomnia kind of symptoms, and their appetite increases, they have increased stool movements. Because of increased appetite, even after increased appetite, because of increased metabolic rate, they lose the weight. So these are the very commonest manifestations we see in when thyroid is getting disturbed, whether it may be hypothyroid or hyperthyroid.
So, doctor, who is at risk at developing this hypothyroidism disorder? I mean, does it always run in the genes?
Regarding genes, it's partially correct. Like thyroid usually runs in families. Mother, parents or grandparents having thyroid history can transfer these genes to the children, and they can have these thyroid issues, whether it's a hypothyroidism or hyperthyroidism. But are there other causes other than genetic causes like autoimmune diseases? Type 1 diabetic is an autoimmune disease, celiac diseases. When patient is suffering from other autoimmune diseases, there are chance of getting thyroid as an autoimmune disease. It may be hypothyroidism or hyperthyroidism. Similarly, stress, smoking, and n number of factors like patient may be having poor diet of iodine. This can also cause decreased thyroid hormone levels, because of which they may suffer with hypothyroidism.
So, to my understanding, I think females are affected more when compared to males, and thyroid in pregnancy is also common. So, what do you have to say about this?
Definitely, as you said, females when compared to males, like 5:1, females are more prone for hypothyroidism. And females, this thyroid is nothing but it's an endocrine gland which secretes hormones, thyroid hormones T3, T4, triiodothyronin and tetroiodothyronin. Females are more prone to having hormonal disturbances, mainly in terms of female hormones like estrogen and progesterone. These are sexual hormones which are controlled by the brain pituitary gland, and these pituitary gland also have a control of the thyroid hormones, because of which they are more prone for thyroid hormonal disturbances, whether it may be hypothyroidism or hyperthyroidism. And age criteria also important, like 60 years, more than 60 years, they have more prone for getting hypothyroidism. And as you said, correct, mainly in pregnancy, there are chances of disturbances in the thyroid hormones, because in pregnancy the requirement of thyroid hormone is more, because these thyroid hormones should maintain both the regulation, metabolic rate of both mother as well as child. Mainly in child, fetus during first trimester, they don't secrete the thyroid hormone, they depend on the maternal hormones. So because of this, their hormone requirement is increased, they may land into subclinical hypothyroidism, and eventually they may land into gross hypothyroidism.
So, does it mean that if one is diagnosed with hypothyroidism, that one is put on hormonal therapy always?
Usually hypothyroidism, it may be because of autoimmune disease or maybe because of iodine deficiency. The thyroid gland secretion decreases, and this usually remains in a long-term basis. So, as long as TSH remains within the normal limits after supplementation of the thyroid dose, we need to continue. In practical scenario, 95% of the patients require long-term doses.
So, doctor, I'm sure diet has a significant impact on thyroid disorders. So, in general, what are the foods that one should consume more if one is diagnosed with hypothyroidism, and what are the foods that one can avoid?
So, as I said, iodine is one of the main trace element which is not produced in the body. It should be supplemented externally. This iodine from the bloodstream reaches the thyroid gland and helps in the formation of the thyroid hormones T3, T4. So, for secretion of the thyroid hormones, iodine is one of the main trace element required. So, iodine, usually we see iodine in, nowadays salt has been fortified with iodine. So, iodized salt will help in replenishing our iodine levels. Not only that, the foods, animal protein foods like seafoods, shellfishes, as well as beef and egg, milk products, cheese, butter, ghee, milk, all this have good amount of iodine. And 1 teaspoon of iodine is sufficient enough to replenish around 2 to 3 years of stores. So, iodine, taking good amount of iodine will help in decreasing the or maintaining the thyroid hormone levels and help in proper functioning of the body. Not only iodine, there are few elements, what we call it as goitrogens, like there are some components of goitrins, some thiocyanates, flavonoids. These are the products which, if taken in large amounts or taken in raw amounts, can cause decreased iodine levels, decreased iodine reaching the thyroid gland, and can cause hypothyroidism. So, goitrogens like cabbage, cauliflower, spinach, broccoli, some kind of millets and pomegranate, some nuts and strawberries. These are all the different foods, what we call it as goitrogens. If we take in large quantities, mainly in raw foods, they can also lead to hypothyroidism. So better limit goitrogen intake.
So doctor, since hypothyroidism is common, especially among women, and the symptoms are so varied and vague, when do you think that one should start screening for this disorder?
Usually I ask all the menstruating females, mainly high risk individuals who have a family history of hypothyroidism or who have a family history of thyroid disease or who have some kind of autoimmune diseases like type 1 diabetes or celiac disease. I usually ask them to check their levels once in 2 to 3 years. It is always better to screen their thyroid profile regularly.
So doctor, since we've discussed about the risk factors, there's one question. If one is diagnosed with hypothyroid, does it lead to thyroid cancer?
Yeah, it's a very good question. Actually, not all hypothyroidisms can lead to thyroid cancer. The cause of hypothyroidism is the major thing which we need to evaluate to diagnose or to know whether they have a predisposing chances of malignancy in near future. So, few hypothyroids or thyroid dysfunctions, when we scan the thyroid gland, we can find few adenomas in the thyroid gland or mass in the thyroid gland, or few may be having goiter, or few may be having some kind of multinodular goiter. There are few masses, cold masses in the thyroid gland which can eventually turn out to be a malignancy. So, only doing the functional evaluation of thyroid gland is definitely an incomplete issue. We need to see what is the ultrasound image of the thyroid gland and what is the cause of hypothyroidism. Based on that, we can evaluate the cause. If at all it turns out to be the malignancy like adenocarcinoma of the thyroid or follicular carcinoma of the thyroid, where you can see hypothyroid status, you can if it in early stage, we can treat it properly by radiation therapy as well as surgery. We can help in having a long life of the patient.
So doctor, it's time to bust few myths. A lump or a nodule in the thyroid, it means that you have thyroid cancer.
Definitely no. It's partially correct, but proper evaluation of that lump or nodule, it can be benign also. If you properly evaluate the nodule, then there are chances of malignancy, and we can clearly evaluate by doing further evaluation of the thyroid gland.
All people with thyroid problems have bulging eyes. Is it a myth or a fact?
It's partially correct. Thyroid gland, mainly there is a disease called Graves' disease, where there is a hypersecretion of the thyroid hormones. It's a kind of autoimmune disease. Like there are some autoantibodies which are secreted against the thyroid gland. In such condition only we can see bulging eyes. Whereas other conditions of thyroid gland, whether it may be hypothyroidism, other conditions of hyperthyroid, we never see a buzzing eyes.
Another one. Only middle-aged or older women have thyroid disorders.
No. There are age groups we see between 20 to 40, between 12 to 20 also we see thyroid. Basically it depends on the cause. What exactly is the cause? If it is a iodine deficiency related, it can occur at any age. If it is a hormonal related, it can occur between 20 to 40. If it is a malignancy related, it can occur at a older age. So based on the cause, we can define what exactly the age can cause the hypothyroid or hyperthyroid.
It is safer and more natural to treat hypothyroidism with iodized salt.
Yeah, only one cause where iodine deficiency can lead to hypothyroidism. In such causes, supplementation or fortified salt intake with iodine will help in avoiding hypothyroidism. But when we take about genetic causes or autoimmune diseases, with iodized salt it never help in avoiding hypothyroidism.
Losing weight is difficult if one is diagnosed with hypothyroidism.
In hypothyroidism, as because of metabolic rate decreases, we see increasing weight rather than losing weight. But in contrary, in hyperthyroidism, when there is a metabolic rate increase, even after taking good amount of food, there is a weight loss.
So doctor, before ending this episode, what message you would like to give to our audience out there?
So thyroid, as we think, it's a very small gland, but it controls all the functions in the body, mainly metabolic rate of all the organs in the body. So if we neglect the thyroid gland, it clearly gives a message that we are neglecting the complete body. So proper checking of the thyroid gland and regular monitoring of the thyroid functions helps in proper evaluation. If at all it is under deficiency range or a higher range, we can supplement with some kind of antithyroid medications or thyroid supplements which help in proper functioning of the body.
So thank you, doctor. It was wonderful having you on the show today.
Thank you.
So this brings us to the end of this episode. We've been discussing about thyroid disorders with Dr. Somnath Gupta. Don't forget to join us for the next week as well. Thank you and stay healthy.